Hello and welcome back to AP Psychology. I'm Miss Lee, and in today's video we are going to be covering psychoactive drugs. We are still in Unit 2, Biological Basis of Behavior. Our learning targets are on the slide that you see on your screen right now. Go ahead and pause your video so that you can take a look and make sure that you are staying on target. If you haven't done so already, go ahead and grab your notes and let's get started. Okay, so the first thing that I want to talk to you about is one of the ways that the brain protects itself is what's known as the blood-brain barrier. This is a border of vessels in the brain that keep the blood from the peripheral nervous system out of the central nervous system, out of the CNS, out of the brain, so that it doesn't have the impact that it might have otherwise. So for example, the blood in your arm and whatever it carries, for the most part, doesn't usually make its way to your brain. It doesn't impact or harm your brain. Some stuff does get through, though. One of those things is psychoactive drugs. These are chemical substances, basically any chemical substances that alter perception and mood, which affects our consciousness. In other words, they break the blood-brain barrier. These psychoactive drugs interact with neurotransmitters at the receptor site of neurons. And at this point, you may want to go back and review the process of agonists and antagonists, just so you know what some of these substances can do at the neurotransmitter site. Repeated exposure to psychoactive drug produces what's known as tolerance. Basically, what that means is that the more you are exposed to this substance, the substance effects lessen. That means that it's going to take bigger doses to get the same effects. It's going to take more medication, more drug to get the desired effects. And once tolerance is developed after this repeated exposure, it's going to take more of the substance to even feel the effects. And this is just a graphic depiction of what I just described. So what I think it's really interesting is to compare the addicted brain with a normal brain, and the effects of the substances that are shown on the chart here at the bottom of your page are an example of what that might look like. Drug dependence or substance dependence, basically you can use those two terms interchangeably. Technically, this means that the body adapts to the repeated use of the substance. It doesn't produce the natural existing neurotransmitter that's being replaced by the drugs. So whatever is happening at the neurotransmitter level, it is affecting your body's ability to make that neurotransmitter. And this happens to the point that withdrawal symptoms are experienced if you stop taking the drug. Physical dependence or addiction is a physical condition caused by chronic use of a tolerance-forming drug. So if you abruptly stop, or even if you gradually stop, this is going to cause withdrawal symptoms, and usually those are very unpleasant physical symptoms. Psychological dependence or addiction is a state that involves emotional or motivational withdrawal symptoms if you stop using the drug. For drugs that are not physically addicting, meaning one cannot be physically dependent on their drug, there are no physical withdrawal symptoms. Or are there? Basically, in 2013, the DSM-5 was brand new, and one of the things that was changed or updated was that substance abuse and substance dependence no longer were two distinct diagnoses. And that meant that experiencing withdrawal symptoms is no longer necessary for a diagnosis of substance use disorder. So if there's physical withdrawal symptoms or not, you don't have to have that as a dependent factor on whether you are making a diagnosis of substance abuse. It's all lumped into one category of substance use disorder. A variety of symptoms can occur when a person that is drug dependent stops taking the drug. That can include fatigue, headaches, tremors, sweating, vomiting, and other varying symptoms, and it can actually cause death in some very rare cases. These are physical withdrawal symptoms. Psychological withdrawal symptoms can include dysphoria, which means just really kind of a long-term, more than depression, just really feeling blue, not reacting to things that you normally find pleasurable. Depression, anxiety, agitation, and anhedonia, which basically means a reduced motivation or ability to experience pleasure. So there are three categories of drugs. There are depressants, stimulants, and hallucinogens. And while the graphic on the right side of your screen doesn't really show the difference in those, it's an interesting graphic. This is alcohol and drug use disorders as a share of total disease burdens across the globe. And you can see that we here in the United States are very disproportionate to the rest of the world. So let's get into it. Depressants. These are drugs that reduce neural activity and slow down body functions. They affect your nervous system, and these include alcohol, barbiturates, and opiates. Just as a comparison, just for kind of fodder for conversation, here is a comparison of the perceived harm of certain drug dependencies, and you can see that heroin, which is an opiate, is right there at the very top. Not just dependence, but also physical harm. So let's talk about alcohol. In low doses, it relaxes the drinker by slowing down the sympathetic nervous system, and it also lowers inhibitions and judgments by affecting the brain. In higher doses, the reactions slow, speech slurs, and skilled performance deteriorates. So basically, at this point, your entire nervous system is being affected at higher doses. It can also affect memory by disrupting the processes of recent events being put into long-term memory. It reduces self-awareness, and it focuses your attention on the immediate situation rather than the future consequences, so it causes impulsivity to increase. And I think it's important to remind just a couple of facts about this. A lot of these symptoms are related to the frontal lobe, and if you'll remember our discussion about the frontal lobes aren't really completely developed until you're in your mid-20s, so a lot of people who are more vulnerable to using alcohol and large amounts of alcohol, their brains haven't even stopped growing yet. They're not fully developed. So it can really disrupt the development of brain cells and brain functioning. It usually takes about an hour to metabolize the alcohol in one drink. Here are some examples of what that is considered one serving. And women metabolize alcohol more slowly than men. If men and women are the same weight, usually the proportion of muscle is different in men and women. And so with men typically being more muscular, just as a genetic component, they metabolize alcohol more quickly. And so if two people, a man and a woman, are the same weight and drink the same amount of alcohol, they are going to be intoxicated at a much different level. Barbiturates. These are drugs that mimic the effects of alcohol. They lower the effects of the central nervous system and in larger doses can lead to impaired memory and judgment. Here are some examples. These are prescription medicines. Opiates. There is a huge opiate crisis in the United States right now. Opiates are considered to be opium and its derivatives, morphine, heroin, codeine, oxy. They depress neural activity, temporarily lessening pain and anxiety. They are highly, highly addictive. So one of the examples of opiates is heroin, and with heroin use, the user gets a short-lived feeling of blissful pleasure. It lasts for about 3 to 5 hours. Usually this is followed by craving for another fix almost immediately. The need for progressively larger doses, i.e. tolerance, and physical withdrawal symptoms. So here's an interesting little fact. Methadone is sometimes used to try to combat a heroin addiction. At the dosages given, methadone is a prescription, and usually the individual doesn't get a high, but it's enough to reduce the intense physical cravings and some of the side effects. However, people can become addicted to methadone. Some of the long-term effects of heroin are effects in the central nervous system, so addiction, tolerance, dependence, problems in the respiratory system like pneumonia. Your heart can be affected. You can actually have an infection of heart lining and valves. Your circulatory system can have many problems, most notably collapsed veins. Your liver can have decreased functions, and systemic symptoms can include abscesses. Short-term effects of heroin include euphoria, alternating alert and drowsy states. So this is in the short term. Your mouth feels dry, your skin gets warm and flushed feeling, your breathing slows down, and your muscles feel more weak. Stimulants. These are drugs that excite neural activity and speed up your body functions. They include caffeine, nicotine, cocaine, ecstasy, amphetamines, and methamphetamines. Caffeine and nicotine are legal, and they are some of the more abused substances. They increase heart and breathing rates and other autonomic functions to provide energy. Caffeine is considered the most widely used psychoactive drug. It increases attentiveness. It improves mood by mimicking adenosine as a neurotransmitter. It's physically addictive, so individuals can experience withdrawal symptoms if they stop drinking caffeine or intaking it in whatever way it usually is through some kind of a beverage. Usually they experience these symptoms a few days up to a week. They can include headaches, irritability, drowsiness, especially if the person is a regular coffee, tea, or soda drinker. And at high doses, caffeine can produce anxiety, restlessness, insomnia, and increased heart rate. So this is sometimes known as coffee nerves or jitters. Amphetamines, this is also known as speed or uppers. Amphetamines suppress your appetite and were once prescribed as diet pills. Then we, as a science, found out just how addicting they are. They're no longer prescribed because of the tolerance to its appetite suppressant effects. So basically, if you'll remember what tolerance means, is that as your body gets more used to the drug, you need more to have the desired effect. So this tolerance occurs very quickly with amphetamines, and the individual needs more and more of the drug to maintain the effects. It's also known to increase concentration and reduce fatigue. It can increase anxiety and irritability as well. Little known fact is that a lot of the ADHD medications started out, or some are still, amphetamines basically. Methamphetamines, or crystal meth. This is an illegal drug manufactured in the street laboratories. It's either smoked or injected. And with all the other amphetamines, after using it for a while, the user crashes, exhibits withdrawal symptoms, fatigue, deep sleep, intense mental depression, and increased appetite. It's highly addictive. The after effects include irritability, insomnia, hypertension, seizures, periods of disorientation, and occasional violent behavior. What's interesting is that over time, it appears that methamphetamine use will reduce the baseline dopamine levels, which means your body stops producing them kind of for the long term. Cocaine is an illegal stimulant derived from the coca tree. Derivatives include Novocaine and are still used today as an anesthesia. Cocaine used to be part of Coca-Cola's original formula. Back in 1888, it was replaced in 1903 by caffeine. Yet the coca leaves with the cocaine extracted for medical purposes are still used today in flavoring in some cola drinks. When cocaine is inhaled or snorted, it reaches the brain in minutes. It produces intense euphoria, mental alertness, and self-confidence, and this usually lasts for several minutes, sometimes 10 to 30 minutes if someone is a binge user. What cocaine does is it blocks the reuptake of dopamine. So think back to what happens in the neural communication. So basically, when the dopamine does not go through the reuptake process, the brain is flooded with dopamine and it causes the user to have an intense pleasure sensation. Here are some of the side effects of chronic use of cocaine. You've got increased chances of strokes, reduced attention, insatiable hunger, problems with your sleep cycles, lethargy. You can develop a sore throat or a hoarse voice. There are a lot of problems with the lungs. There are a lot of just systemic problems like fevers. You can have problems with your nose, with your teeth. Your heart can increase the risk of a cardiac infarction. You can even develop problems with your skin. Okay, ecstasy, MDMA. This is a stimulant and a mild hallucinogen. It increases empathy, peacefulness, and the person feels calm or thinks they feel calm or relaxed, but at the same time, they also seem to have an unending supply of energy. This makes it a popular club drug, and the immediate dehydrating effects combined with prolonged physical activity like dancing causes the person to risk severe overheating, increased blood pressure, and sometimes even death. Researchers have found a decline in long-term memory and performance on IQ tests. They believe that MDMA causes long-term serotonin changes in the brain. So here you have another drug that basically causes long-term effects at the neurotransmitter level, long-term changes to happen. And this could lead to reduced serotonin levels and increased depressed mood and sleep problems. Hallucinogens. These are also known as psychedelics or mind-manifesting drugs that distort perceptions and evoke sensory images in the absence of sensory input. They include LSD and marijuana. LSD, lysergic acid diethylamide, or acid. One of the most powerful drugs known, it only takes a millionth of an ounce to produce altering effects. This was first synthesized from a rye fungus back in the 1930s. The person who made it accidentally ingested the substance and had the first LSD trip. An LSD trip usually lasts between 6 and 14 hours, but the effects vary greatly. The person can experience visual distortions and hallucinations, and they can experience very intense emotions and moodiness, very intense and unstable, impaired thoughts, and they can experience what's known as a bad trip. This is terrifying, and the users can end up being in a state of panic. They feel like they're going to go mad and never kind of come out of it. This can actually lead to some really tragic endings. This can also cause flashbacks. These are sudden, brief recurrences of the trip weeks or months after the use. Marijuana. Marijuana produces feelings of elation, promotes relaxation, relieves inhibitions, relieves anxiety, increases sensitivity to sights, sounds, and touch. It can also cause the sense of time to be distorted. The active agent, or THC, in marijuana is what produces the high. It remains in the body long after the use. Up to 10% can remain in the system even after 7 weeks. The effects include impairing attention or coordination, slowing reaction time, interfering with concentration, logical thinking, ability to form new memories, and the ability to hold in your mind what has been said. Chronic use is associated with loss of motivation and general apathy, so just not caring anymore. It also causes respiratory damage faster than cigarette smoking. Heavy use can affect the reproductive system, especially in males. So it's important to consider when we're discussing drug use and drug abuse that there are a lot of influences on what makes a person decide to use drugs or abuse drugs. First, you've got biological influences, and those include kind of genetic tendencies, but also a person's individual dopamine reward circuit. Some people just have a more sensitive dopamine reward circuit. Psychological influences can include already lacking a sense of purpose, a lot of stress, psychological disorders like depression. A lot of people are thought to kind of self-medicate with illicit drug use. And then you've got social cultural influences. So you're more likely to use if you are in an urban environment, if you belong to a drug-using cultural group, and your peer influences. But the biggest influence on what someone experiences is actually going to be what their expectations of that experience are. That's going to include your own past experiences as well as what you've been exposed to in your household, in your community, with siblings, with peers. And that is it for this video. In our next video, we're going to be talking about sleep and dreams. I can't wait to see you then. Bye for now.